The origins of cash transfer programs really goes back to Latin America in some ways. And in the aftermath of neoliberal reform that many countries in the global south were liberalizing capital markets, privatizing, because the diagnosis at that time in the 90s, particularly with what we now look back and call the Washington Consensus, was that the state is the locus of corruption and rent seeking, particularly in developing countries. So you have extensive privatization, sort of reorienting of this, the new lean, thin state, this hope that market-led growth will be the driver of poverty alleviation. And there were huge, consequences to the implementation of that agenda, right? And states, countries like Mexico and Brazil that have been pioneers in building cash transfer programs, governments in these countries increasingly became concerned about the consequences of market-led development, neoliberalism, in the absence of any kind of robust safety nets. So existing safety nets that these countries had, again, resonant with Pakistan, were either woefully inadequate or poorly designed, often in the Latin American context, accused of patronage and clientelism. So governments in these countries, taking, for example, the Mexican government, which is one of the pioneers, their program Progresa is one of now the most heavily evaluated cash transfer programs in the world. Designed these programs where they decided to do, the most important feature to tell you is these are targeted programs, right? So they're targeted at a specific segment of the population, typically vulnerable populations, typically poorest of the poor. And most importantly, again, for the program we're going to talk about in Pakistan, they're often targeted at women, and the philosophy there, and there's been some debate about this, is that the idea of giving it to mothers in particular, so married women with children, and the idea is that women are more likely to spend this on household welfare, particularly the welfare of children. So there'll be investments in education and health. The work of Abhijit Banerjee and others has shown that actually giving money even to poor male-headed households, this myth that they would spend it on alcohol or cigarettes, to give the cliched example, is not true. That we do see these effects as well. So Mexico implemented this program, which was initially called Progresa. It's also had many iterations of name changes. And they built in part, because it was a targeted program, they built in an evaluation component from the very start. So you had, because these were non-universal programs, you could give, you could study the effects of giving cash transfers to a certain number of households based on certain metrics for eligibility, and then compare the effects of receipt of the cash transfer on households who narrowly missed eligibility. And in the Mexican case, these kinds of, and you see this again being replicated in many other programs, including the program in Pakistan, you have now over 20 years of data on the efficacy of these programs. And you find that not only do poor households who receive these transfers from the state, not only are they spending them on things we would immediately expect them to spend on, right? Food, for example, flour, tea, depending on the context, essential items. But they're also keeping a portion and spending it as we'd expect. And particularly, there's some really interesting data, again, from programs in Latin America, but now so many other parts of the world, on education level nutrition. This then gets scaled up eventually by the World Bank, by DFID. This becomes a model So again, it fits also, it's a response to neoliberal reform, but it fits also within the logics of the neoliberal state, because it's a very targeted, it's not a universal program. It also becomes more affordable for states, and this, because rather than, because precisely because they're targeted programs. And there's a policy diffusion effect, right? So in the early 2000s, you see, early to late 2000s, you see these programs gradually moving out of Latin America, emerging. Bangladesh develops a CCT program, a conditional cash transfer program. You see countries in sub-Saharan Africa doing it. And then Pakistan in 2008 becomes a very prominent case. So that's the global, that's the global setting. In my own work, I was really interested in the domestic story in Pakistan. So, okay, we know this wider story that I've just broadly charted out to you, that there is there's policy diffusion. You have powerful multilateral organizations like the World Bank, DFID, the donor organizations eventually come around to supporting these programs, helping design these programs. But why do governments implement these programs? And why do these programs then in some settings remain small pilots that die away, and other settings like in Pakistan become these big national programs that become part of the state? So in Pakistan, the story starts in my research around the transition from military rule to the return to party politics. And this is, in the political origin story that I tell in my doctoral dissertation, now book project, is how the transition to democracy creates these macro structural conditions for parties to once again do what parties do, right? Prepare manifestos, try and make policy appeals to voters. And the People's Party government, which had often, and often it still is, accused of a party that claims to be a party that represents the interests of the rural poor of Pakistan, that gave many of these iconic sort of you can say ideological slogans, roti, kapra, and makan, that everyone, that the poorest of the poor have entitlements from the state of bread, clothing, and housing, right? So how this party has done so little. And so in 2007, you have the People's Party at that time under the leadership of Benazir Bhutto that was broadly looking at, and this is when the manifesto is being written. This is the tail end of the Musharraf period about building, and you can, I cite that manifesto, and I interviewed people who were involved. It's a combination of technocrats and people within the party, where the party leadership under Benazir Bhutto had said, we want to build a new flagship anti-poverty program. It's very vague. There's no mention of cash transfers. Parties makes all sorts of promises, right? So it doesn't mean much right now, but there's some articulation, some vague articulation of a vision.